Okay, ladies and gentlemen, we are ready to get started. And we are, once again, I'm so glad all of you have come. And I'm going to do my best to keep the temperature in here a comfortable temperature, which means some of you are going to be cold, some of you are going to be warm, which means it's just right. So, we're at that very interesting time of the year where you don't know whether you should use the air conditioner or to use the heater. So, but we are just, again, so very excited about Dr. Lee Wellard being here with us. And did you all enjoy the presentation yesterday? Just powerful presentation and thinking a lot, Dr. Wellard, about the astronomy presentation from yesterday, and again, I will reemphasize my offer. If you need someone to clean the telescopes, Debbie and I'd be happy to move to Arizona. We don't want to leave behind the Battle Creek family, but it would be. Looking at the stars is something. I was telling Dr. Wellard yesterday. As a boy, we used to camp in the Upper Peninsula of Michigan, and if you go to the Keweenaw Peninsula in Copper Harbor, which is right at the very tip. And I just remember as a boy looking up, and I grew up in the Chicago area where you can literally count the stars because you don't see very many of them. But up there on the dark shores of Lake Superior, you can certainly look up into the vast expanse and see many, many stars. And so just appreciated that, Dr. Wellard. What a powerful way to end the afternoon yesterday. We're going to have a word of prayer, and one of the things I'm going to ask for everybody is Dr. Wellard is going to do a Q&A, and what I'm going to ask is for you to reserve your questions for that time of Q&A, and probably more of us have more questions than he can handle in the time that we have allotted. And so what I would encourage everyone is if you've got that one question, put that at the top of your list and allow for others to be able to ask their questions during that Q&A time. So let's pray together, and we'll invite Dr. Wellard to come on up. Heavenly Father, we are so grateful for the opportunity to be here, and we're so thankful for us to be able to understand all that you've done on this earth by creating the various plants and knowledge that we might be able to utilize those remedies in the various ailments we may face. Father in heaven, we know that you want us to be in good health, and so I pray that over the course of the next several hours that you would help us to learn things that would both help us to get into and stay in good health. Please bless Dr. Wellard with the right words to say and give him wisdom and understanding on the direction he should take on the various topics in his presentation. We pray this in Jesus' name. Amen. Dr. Wellard, I want to invite you to come on up, and I want to not neglect, we have an online audience. We are live streaming this, so again, if any of you missed anything that are here in person, you can go back and watch the recording. Those that are watching online, we're thankful that you're watching wherever you might be. So Dr. Wellard, thank you.
Well, welcome back. Good afternoon. Great to see everyone. And I hope you got a pen and paper. We're going to be covering quite a bit of information. And specifically this afternoon, we'll be looking at how we can use herbs intelligently for many of the common conditions that we face today. I just want to give a disclaimer here that this information presented is for educational purposes only. No information given is intended to be used as a substitute for good lifestyle habits or well-informed medical advice. Please use your own common sense in applying what is said here, remembering that herbal remedies are not a cookie-cutter approach to every condition. What herb may work for one may not for another, and what may be good in certain situations may not be recommended in other situations. There are no panaceas. There's no one-size-fits-all. Herbs have their place, and they also have their limitations. However, if used correctly, they can help solve a lot of issues that may require medical intervention if not used at all. Any health advice can be harmful if not placed in its proper setting. So do your own due diligence that success may attend to your efforts. Is our current medical system really working as far as lessening suffering and disease? No. You know, I was sharing yesterday how we pay for our health in one of two ways. We get educated or we get medicated, right? There's no real alternative than there, you know, another third option there. But unfortunately, we are approaching, the way we're approaching disease, it's like, imagine this, you go home and there's water all over the floor. Ever had that happen? And the sink's on, and there's a plug in the sink, the faucet's on, should I say, the plug in the sink, and there's water everywhere. And what's the first thing you do besides scream? Turn off the water, that's right. Then what's the next thing? Unplug the sink, and then finally get the mop, right? So you would probably think I'm crazy if I just got the mop and just let the faucet keep going, right? I mean, it's futile experience. And that's exactly what we're doing. We're trying to mop up the symptoms, but we're not getting to the cause. We're not getting to the actual rubber meets the road situation where we can turn people away from what is causing the very conditions. We need to educate, and physicians above all people should be educators, not just medicators. And because that is the role of a true physician. Jesus himself exemplified that in his life. And we use these things, as I mentioned yesterday, when we're talking about herbs, we use them as an adjunct therapy to a healthy lifestyle. So if you're taking some turmeric root, which is great, but you're living under the golden arches every day, it's probably not going to be the best approach, right? All right, so we need to remember that these things work more effectively when we have a healthier lifestyle. I sort of preempt this here, but I usually ask the question, how many deaths do you think occurred in the United States in 1 year from herbal remedies? The answer's already here. Okay. All right, so no prizes today. But out of 60 billion supplements consumed in the United States, the last report we have from the Poison Control Center was 0 reported deaths, 21 major reactions, 603 minor reactions. And largely, there have been a few isolated cases in history in America where someone did die from a product that had some herbs in it, but it wasn't from the herbs. Can anyone tell me what they think those products could be? They're very common products. No, they are, no, not vitamins, no marijuana, no, no, yes, energy drink. Who said that? Well done, well done. Energy drinks, and the other one was weight loss products. And what did two of those have in common? Caffeine, that's right, caffeine. Do you know, you can look this up, that in the United States, in 1 year, there's about 4.5 million visits to the ER from caffeine-related situations. 4.5 million. Usually it's a arrhythmia, you know, tachycardia situation. So it's one of the biggest causes of people going to the ER is caffeine-related. And if you take too much caffeine, you probably heard some news reports along the last few years about youth taking maybe 1,000 milligrams of caffeine and ended up dying, you know. So caffeine is a drug. Don't recommend it. It will accelerate metabolism, but at the expense of your health. So it can make you more alert, of course. That's often why people take it for the energy. but it throws you off the cliff at the end of the day. It will affect your sleep. It affects these adenosine receptors. Adenosine is a chemical in the body that makes you relax. So caffeine substitutes for adenosine, and you can't switch your brain off at night, and it keeps you awake. And it's good for truck drivers and people who are working in night shifts, but it comes at a great cost to one's health. So if you want to take a coffee substitute, has anyone heard of Ticino? Okay, Ticino is a grain coffee, and it's made out of things like chicory and ramen seeds and dandelion root. And if you get the one called French roast, it's the closest tasting to coffee. I mean, I couldn't tell the difference. When I grew up, I used to have coffee now and again, and it just reminded me so much of Teeccino, Ticino, and it's called French roast. There's different kinds there, but if you want to get the flavor, you don't want to get the negative aspects to it, and if you want to get energy without using caffeine, I'll be sharing a energy herb that can help you through this presentation. So Ticino, Teeccino. Okay. So plants, they support the body, okay? They are adapted to meet the physiological needs of the body. They provide large amounts. And when we're talking about medicinal plants like we'll be sharing today, things like turmeric root and red clover and all these herbs we'll be covering, they are very different than plant foods, okay? Because we don't eat a whole bunch of them to get our nutrition. They're not high in protein. Actually, they don't have protein, fats, and carbohydrates. They're really concentrated forms of phytochemistry. Okay, they have antioxidants, they have minerals, vitamins, but they're not standard plant foods, as we would call them, although there are some that meet that category. So they support the body. They're not just correcting something and creating a problem elsewhere. Okay, that's the beautiful thing. And here's something you want to keep in mind. The longer you take a herb, the less you'll need of the herb. Why is that? What's that? Builds tolerance. Okay. Any other? Yes. Okay, yeah, I understand what you're saying. I was sort of coming at it through different lines a little bit. Let me explain this. The longer you take a herb, the more nutritional reserves are building up in the body, so you don't need as much over time. Whereas with common medications that are often prescribed, the longer you take them, the more you need of them, right? Because right. So all drugs that are poisonous to the body and are foreign in nature, they require nutrition to metabolize them and to get rid of them out of the body. And so the longer you take them, the more nutrition you're losing. And this is why it creates long-term side effects. It's utilizing nutrition to try to balance the body's needs. And so when you take a herb, the longer you take it, the less you need of it because the body is storing those things for the future. They carry a lot of antioxidants and phytochemicals that help regulate the immune system, protect the body from disease. You know, we never get addicted to things that we need, right? I mean, we don't get addicted to carrot sticks and broccoli and tofu, right? It's sugar, right? I was walking through the airport the other day, and I just couldn't help but notice how everything's loaded with fat, grease, and sugar, right? And if you want to have a successful food business, you got to have fat, sugar, lots of oil, right, to make it taste good. But God's plan is to make us satiated without making us chemically dependent. In fact, I enjoy my food much more now than I used to. My taste buds just really relish just simple foods. It's and we have a lot of good variety, and we don't just eat lettuce leaves and carrot sticks. We do eat some very nice food, but we use herbs. Herbs are great seasoning agents, and I'll talk more about the culinary aspect a little later. So what drives disease, okay, is inflammation. It's the silent driver, okay? And so all the plants that God has made for us to consume, whether they be plant foods or plant medicines, they are anti-inflammatory in nature. Okay? Now, when you pull the plants apart and you refine the things like flour, for example, you refine the chemistry, you take some of the fiber out and you extract certain elements, then you can make it pro-inflammatory. But everything that God gave us to eat and to thrive is anti-inflammatory, so it protects our body. And I was talking yesterday about stress. Stress is one of the main drivers of inflammation. And the reason for that is because it accelerates the stress hormones like cortisol, right, adrenaline. And when you have these chemicals suspended in the bloodstream too long, over a long period of time, then it can cause inflammation to occur. All right, so we got to get to the cause. We got to turn off the faucet. We got to unplug the sink, and then we can use the mop intelligently. And so the plants can act in a way like a mop, but they're more than a mop, okay? Because they often give back not just things to help balance the system, but they give back nutritional support that sustains the system. All right, so plant compounds are very high in anti-inflammatory properties. And vital nutrients from foods can regulate inflammation and immune responses. And so I believe the best diet that has ever been given was the original diet that God made for man, right? Which was, he didn't tell Adam to eat dinosaurs, right? He did. Not that they were around in his day, but anyway, they were, the garden was equipped with every nutritional element to sustain man's health. And I believe we can improve on that program. You know, in the end, we go back to the beginning, right? Now, one of the best herbs for inflammation is turmeric. Now, let me just share with you a few things that often people don't understand about turmeric. You do not need to take black pepper with turmeric, okay? Now, the reason for that is because turmeric has a chemical called curcumin, okay? And curcumin is what they deem as an active constituent of turmeric. Now, you can take curcumin out of turmeric, and you can take the rest of the turmeric, and it will still give you an anti-inflammatory effect. So it's not just curcumin that's causing an anti-inflammatory reaction. In fact, there are over 5,000 phytochemicals in turmeric, and many of them are anti-inflammatory. So often people confuse turmeric with curcumin, and so they go to the health food store and they take curcumin, and they think that it's the same as turmeric. Well, it's an isolate from turmeric. So when you take curcumin that's isolated, it metabolizes quickly in the body. The liver will break it down and get rid of it in about 20 minutes. So to stop that from happening, they recommend you take black pepper, because black pepper has piperine in it. Piperine suppresses the liver's action to metabolize the curcumin. So that means that it suspends the curcumin in the body for a longer period of time in the bloodstream. But if you take the turmeric as a whole, you do not need black pepper. Okay? Does that make sense? I'm making a bit fast there if you want me to repeat it. happy to. But black pepper is a gastric irritant, and so that's why I don't recommend you take it. Now, there are herbs that can help with a speedy delivery of those properties to various parts of the body. We call them circulatory herbs, okay? Things that move the blood quickly. So what herb can move the blood quickly? Anyone? Nitric oxide. Well, nitric oxide enlarges the lumen, the blood vessels, and it's helpful for circulation, but it doesn't. Cayenne, yes, cayenne will help. It will activate the blood. It helps with recall action with the blood vessels. Be very careful about cayenne. I've got a slide. I'm going to talk more about cayenne. You have to respect cayenne. You don't want to put it in your eyeballs and your nose and your ears, sensitive parts of your body. Don't use cayenne soap unless you want to run a marathon. It'll get you moving. We looked at garlic. Okay, garlic is a wonderful herb because garlic, if you want to help your blood pressure, take some garlic. Okay, if you want to keep away certain friends, take garlic. Okay, all right. If you want to help with blood clots, garlic is the number one. Yeah, because it has allicin in it and mustard oils. And what it does, it can help dissolve blood clots. It's very good as a blood thinner. All right, so you can take, now you can get these garlic concentrates like allicin. You can get a allicin supplement. Actually, a few months ago, I had to have an emergency root canal done on one of my teeth. I had a dentist try to, he thought he cleaned out the cavity and he put a crown on it. I bit on some popcorn, you ever had that? And it cracked my tooth in half. And so I had this cavity and he cleaned it out and put the crown on and thought everything was hunky-dory. And then started to get some pain, and he couldn't schedule me for a couple of weeks. And you know, if you get nerve pain, it can get pretty bad. So I was putting my pain formula on, and it was really effective before they capped it, because once they capped it, it couldn't get direct contact on the nerves. So I went into getting emergency surgery done, and I knew I was in trouble when the assistant started tapping me on the shoulder like this. I thought, oh boy, this is and then I see this 6-inch needle coming out. I knew I was in trouble. I sent up a few prayers at that time. And he had to numb all the way around. And it took me everything I had to stay on that table, I tell you. But afterwards, after those anesthesia wore off, it was excruciating pain. And the dentist told me, he said, look, I want you to know that this could get worse. And what could happen is that you end up actually not being able to breathe. That was very comforting because of the swelling that was going to happen if this didn't get taken care of. And so he said, here's the strongest antibiotics. You need the strongest antibiotics. And I was like, oh man, I really don't want to get these antibiotics, because I deal with people with antibiotics and they come back every 2 weeks with a worse infection. And they do work, but you know, you suppress the immune system. So, I mean, I was willing, but I was like, Lord, is there a better way? So he impressed me to get some allicin, which was a get from the garlic. So I took some allicin tablets and also used some clay, some bentonite clay. Now, I was beside myself with pain. You know that feeling? You can't even think straight. You just, in fact, a police officer came by my car, and he thought I was a drug dealer because I had these, these quart jars. I drink out of quart jars. He thought there may be some moonshine in there, I had this herbal extract there. He wanted to sniff that. I was like, I'm just drinking to the dentist. And so he was tough to case me out, make sure I didn't have any drugs on me. I got some clay in the health food store, and as soon as I put that on, the pain started going down, and I was so thankful. It's like, thank you, Jesus. But clay and garlic saved the day, for me anyway. But garlic is a very, very powerful herb. If you've got any bacteria or viruses or fungus, it is amazing to help with that. And blood pressure works amazingly as well. And it does get the circulation going, and you can use it topically. You can use this with some olive oil. Put it it can burn slightly. That's why you have to use some carrier agent with it if you're going to use it topically as a poultice. Hang on a sec. We covered turmeric, didn't we? So, actually, do I have 2 slides of turmeric? Oh, yeah, I did have 2 slides. Sorry. Well, let me tell you more about turmeric. Okay, so very good for arthritis. Very good for arthritis. And it's been studied more than any other herb on the planet. It's over 6,000 clinical studies been done on turmeric alone. It's the most studied medicine by far. Out of all modern medicine, it doesn't even come close. And turmeric is very effective for even things like depression. It can help with diabetes. There's even clinical studies showing how it helps benefit the pancreatic beta cells. It's been studied on various different cancers. In fact, one of the best research out there on the effects of turmeric on cancer is with bowel cancer. So if you got someone with bowel cancer, turmeric root is phenomenal to use. And the best way to take it is either, now if you're going to use the powder, use it like, mix it in a smoothie or something. Now a lot of powder has lead in it. Okay, I just want to share that with you. 99% of turmeric sold has lead in it. And the reason for that is because they dye turmeric to keep the color nice for you. And the dye they use has a lead base in it. And so, yeah, isn't that... Some organic does as well, so you got to be careful. There's more organic. Yeah, if you're going to get an organic root, that would be preferable than getting a powder, okay? Because they don't dye those things, okay? Yeah, yes, you can do that. Yes, yeah, we'll get into that a little later. But turmeric is great also for helping with rheumatoid arthritis, and it works very, very effectively for swelling, painful joints. You can use it also for as an immune enhancer. This is very effective. If you start to get some cold, flu, you can also add this. I would recommend you take with elderberry, as we mentioned yesterday. But any inflammatory condition, right, is helped by turmeric. And the amount of, I would recommend, if you're going to take the powder, is around 1 teaspoon per day. I do recommend more the extract because it goes straight in the bloodstream. It doesn't require any digestion to be assimilated. Ashwagandha. Okay, now ashwagandha is what we call an adaptogen, and that helps to mediate the stress response. It's very good for helping balance the cortisol. It's good for the adrenals, for the thyroid gland. It actually helps with energy. It's not as strong as rhodiola, but it is just as good for managing stress. It can help you sleep at night. If you take it in the morning, it can help you sleep in the evening. It has about 50 different functions to this herb that we know of, right? So there's many benefits to this, but where it shines the most is the neuroendocrine system, okay? And so any herb that's an adaptogen helps mitigate the stress response. It helps resist the fight or flight response. It can also help in certain situations give you more energy, more mental clarity, and protect you against getting sick. Astragalus root is another excellent one. It's very supportive to the immune function. It's even recommended in some cases by certain physicians who are helping people to recover from chemotherapy after the chemotherapy treatments. This can help increase the white blood cell count. So, you know, not all physicians will do this, but some who are treating people with leukemia recommend this. Some of the best medical cancer centers, like Anderson Cancer Center. When I was over in Texas, I met one of the head nurses, and she said they use herbs as an alternative for people that request them. Okay, so these are sort of herbs that could be used for that. Yeah, it's great for certain types of infections. We have a formula we use this to make. It's called Super Immune Booster. And it's very good for people that are trying to enhance their immune function. And I'll share a story with you. Just recently, I had a phone call from a gentleman who was from Brazil. His brother was in hospital in Florida, and he was in urgent care. They had given him antibiotic after antibiotic after antibiotic, and they basically gave up, left him to die, and he had all these tubes in him. And so the brother called me and said, "Have you got anything?" I said, "Well, this is the best one that I could recommend." And he said, "Can you overnight it to Florida Hospital?" It was like $168 to ship it overnight, direct to the hospital. I said to him, "Look, I don't think the doctors will use this. You know, I mean, I'm happy to send it to you, but if they're not willing to use it, then you're just wasting your money." So he said, "Just send it, and we'll ask them to use it." So we sent it to him, and he had a feeding tube. So the family persuaded the doctors to give it a try because they had nothing else in their toolbox. So there's nothing to lose, right? So they didn't expect anything to work. So they put in his feeding tube. I said, "Look, I just want to make it clear, don't expect immediate response. It could take up to a week, you know." And so he got back to me 5 days later, and he said, "My brother is coming out of it. He's recovering." And he was so excited. And I don't know what the doctors thought, but they were probably encouraged, but they probably said it wasn't the herbs, it was the medicine that they gave him or something. But anyway, so if you know, unfortunately, people use things as the last resort sometimes when they really should be the first resort. And I'm not saying herbs should be the first resort for everything, but you know, they do have limitations, but if you understand how they work, if you have that knowledge, you can use them in a much wider capacity than what you would commonly think. Let's talk a minute about hormones. Oh, thank you. Save the day. He needs some of this water. Thank you very much. Okay, so we touched on this yesterday. We didn't really get into it, but herbs can also be used a lot for helping with hormone regulation. What was the herb I mentioned yesterday? Vitex. Okay, very good. You were listening. Also known as chasteberry. that is excellent to help balance the hormones. Now, it does help with progesterone. It works on the hypothalamus pituitary axis that governs all the ladies' reproductive hormones, one of which is luteinizing hormone, which stimulates the production of progesterone. And so Vitex, if you're low in progesterone, it can help bring it up. Okay. If it's too high, it can bring it down. It's a normalizer. You know, there are no drugs on the planet that will do both sides. But God has made some herbs that do both. It's amazing. Yeah. Same with red clover. You heard of red clover? I'll talk a little bit more. I've got a slide on red clover. But it's very good for helping with estrogen. So if your estrogen's too low. Red clover. Yes, that's right. Yeah. The botanical name is Trifolium pratense. There's some clover that's called red clover that's not actually real red clover. It's like a close proximity, but it's not the true botanical name or the species that is medicinal in value. So when you're looking at a herb, just keep in mind that there are different varieties of that herb. There's different species of that plant. So try to ascertain which one is the most effective. I can't give you a whole list, but if you remember this word, it will help you a lot. It's called officinalis. Officinalis. O-F, is it one or two Fs? I forget now. Two Fs. I-C, I-A-N-A-L-I-S, something like that. Okay, I hope I get that right. Officinalis. But that's like the mother plant. It's like it hasn't been hybridized. It's considered the most medicinal. I used to have people come in my store and say, I want some lavender. And I say, which kind of lavender? They say, I don't know, just lavender. And I tell them, well, there's 400 different types of lavender. What do you want it for? And they say, well, I want it for sleep. So I said, well, get Lavandula officinalis. That's the one you want to get. And so it helps them to know about plants. You know, we may call them basil, we may call it frankincense, whatever. And there's different varieties they're sharing the same name. So it can be quite overwhelming when you study this, you know, in the beginning, but it gets a little easier as you study it out. But try to get the specific Latin name, and that will help you to identify which particular variety to get. So the stress is very, very important for the hormones as well. And here's why. Because the same building block that's used to make a lot of our stress hormones are making hormones, our sex hormones. All right? So, for example, the first block the body uses is cholesterol, and then it's converted to pregnenolone. And then from there, there's a bifurcation takes place. It could either go to progesterone or it could go to cortisol. All right, so that means that the more cortisol your body makes, the less it can make the progesterone. And why is this important? Because that's going to shift your sex hormone production. And this is why ladies, who especially when they hit their middle years and start going through menopause, they have a hard time regulating their hormones because they've had a lot of stress leading up to it, which causes their adrenal glands to not be able to gradually accommodate them, transition them over to menopause. So they have a roller coaster experience as a result of this. And stress is heavily involved in this. So your stress will affect your adrenals, will affect your thyroid, will affect your neuroendocrine system. It will affect your sugar, your metabolism. 20% of people get diabetes from just stress alone. Heart disease, very much connected to stress. And, you know, as I mentioned to someone yesterday, what causes stress is when you think you're not in control. Okay, and the biggest stressors are the things that affect your heart the most, the things you're attached to the most, whether it be children, whether it be your job or your money or your reputation, whatever it is, your house, whatever affects that the most causes the most stress, okay? And the truth is, we weren't in control to begin with, right? We just had this illusion that we were in control, and then the Lord shows us we weren't in control, and we get stressed. We're trying to manage stress. So stress management, to me, is an oxymoron, because you get stress from trying to manage your stress. That's what creates stress. Okay? So we're not trying to manage stress. Okay? We're trying to give our stress over to God, because He says, "Come unto me, all ye labor heavy laden," which is stress, "and I'll give you rest." So there's this exchange that goes on from stress to rest. And so God never promised us that He would give us stress. He promised us rest. And often we think we're immune from it. And it sometimes takes some outside person to see that we're stressed. Some people, we have the Savior syndrome. God has to save us from our attempts to save ourselves. And sometimes it takes us a long time to get to the point where we're willing to realize that we weren't in control to begin with. What's happened there? Okay. So, returning back to God's design. This is part of the program of helping to get back to where God wants us to be, and that includes trust in the Lord, exercise, proper diet, and the other laws of health like good sleep and fresh air and sunshine. I'll finish on this one then, because we started a little late, and then we'll have a break. Cayenne. All right. Now, if you want one thing that you could put in your first aid kit, emergency first aid kit, it's this one here, cayenne. Because cayenne is, it's not just the spice of life, but it is a powerful medicine. It can help with heart attacks. Yeah. You can go online. You can hear lots of people's testimonies about how they had a heart attack and cayenne saved them. In fact, I had a lady call me not so long ago, and she said, "I was at your lecture, and I heard you talking about cayenne." And she said, "I had a heart attack, and I took some cayenne while I was waiting for the paramedics to arrive, and by the time they came, I didn't need them." Also, it's good for strokes. If you have a stroke, take cayenne. You can take it as the powder in some water, or you can, now even people who have a heart attack, they can still swallow, unless they're unconscious. No, I would just mix the powder with some water. You never put direct powder in someone's mouth. So mix it up with water. They can still swallow, unless they're passed out. Then you can't do anything except try to do CPR. But pills usually are compressed, and they have fillers, and they're not as strong. So if you want the ideal stuff, get an extract. It's a liquid form. It's already made, and you shoot it straight in their mouth, have them swallow, and this will help as a vasodilator. It will facilitate better blood flow. If there's clotting that's taking place, it could even expand the lumen of the blood vessel to allow blood flow to still circulate. And it can keep the capillary beds moving, more oxygenation take place. So cayenne is a phenomenal one. Also, it can help with hemorrhaging. In fact, there are not all of them, but there are some paramedics that use cayenne powder in the case of hemorrhaging. All right. There was an incident years ago where someone lost his arm, and his friend knew about cayenne, and he doused his arm stub with some cayenne powder. And when the paramedics came, they chastised the friend, took him away, and then they called him back later and said, "We're sorry, you saved his life." Because what it does, it cauterizes blood vessels, damaged blood vessels. Here's the thing, it won't cauterize healthy blood vessels, but it will cauterize damaged blood vessels. So you can use it for pain, clears congestion, stimulates circulation. It can also help improve the thyroid gland. It can help stimulate metabolism. It can help with headaches and migraines and flus and colds. One time I was on a plane. I was traveling from the States to Japan, and it was a 13-hour flight, and my feet started getting cold the last couple hours. So I remembered I had a cayenne salve, so I got some of it and put it on my feet. And after about 20 minutes, I didn't feel anything. So I thought maybe I didn't put enough on there. So I got some more, and I put some, lavished my feet, and didn't feel anything for about 20 minutes. So I thought, well, maybe it's old. Maybe it's maybe I need to put more on this. So I got some more. And put it on, really covered everything. Everything was so greasy with cayenne. And I didn't feel anything for 2 hours. And here's what I didn't know. I didn't know that sweating activates the capsaicin, the heat properties. So I get off the plane, I start walking. I said to my wife, "Honey, my feet are getting warm." And I took a few more steps. I said, "Honey, I think I'm firewalking." I had my foot up in the Narita Airport water fountain, trying to cool it down. Next day, the skin off my foot was gone on the bottom of my foot. So be careful, be very respectful to cayenne. It's not something you want to overdose on, okay? All right, so what was the carry? Well, I had it in a salve at the time, so it was in a beeswax olive oil base. So let's take a 10-minute break, and we'll come back and talk more about some herbs for pain. Yes. For a heart attack, if it's a powder, I would do a teaspoon in some water. If it's extract, about 2 to 3 milliliters. Okay. Okay. Hey, bro.
I had a heart attack about 5 years ago. I'm fine. It was just a life. But my mother had congestion heart failure and passed away. So it's in the family totally. It's
Okay.
and then I got sugar diabetes. I've been walking and eating better, and my sugar's down.
Okay, we're just gonna start just 1 minute here.
Okay, no, take your time. I just,
Yeah, yeah, fine.
I'm gonna make sure that you're
Sure,
fine.
yeah, yeah, we're good,
You've got
we're
your
good.
water over there?
Yep,
Anything
we're
else
good.
you need?
No, fine, thank you so much.
And you know, which means it'll be there on our YouTube channel. Yeah, just look up Battle Creek Tabernacle and it'll come right up. We had a brief audio problem in the last
Okay.
presentation, but we've resolved it.
Okay, great. We're ready to go?
That wasn't your problem.
Okay. All right, we ready? Ready to go? Okay. All right, if you'd like to take a seat, we'll start again. We're going to be talking about pain to start with. Anyone got some painful joints or anything here? Okay, wow. There's quite a few of you. Okay, I bought a demo here. So this is a pain salve. You just rub it on your joint, okay? Someone else put their finger in it. Don't worry, it's an antiseptic, so no chance of getting any contamination or bugs or anything. So I'm going to pass this around, and feel free to use it. Don't put it in your eyes, okay? Don't get it near your eyes, all right? We just want to make sure. All right, and don't do what I did and lavished too much, okay? But it's not as strong as I went overboard on mine. So it's a pain salve, and it's got some infused oil with cayenne. It's got some beeswax. It's got some frankincense, clove, wintergreen, eucalyptus, peppermint. What else has it got? Some lavender. Ginger as well. So it's got a lot of really good essential oils in there. So yeah, we make those. So it's called pain salve. It's called pain salve. Yes, pain salve. Well, it's not really used for that. So for restlessness, do you mean like restless leg syndrome? Oh, I see. Okay, no, this is something different. Sorry. Yeah, but we'll get to that. Hopefully, we'll cover all these things in the presentation. But let me share with you. This is a herb that's very much underrated. You don't really read a lot about this online. It's not a major herb for most people, but it's very good for pain. And I got onto this years ago. I was looking for what is good for pain relief instead of people get commonly the NSAIDs or non-steroidal anti-inflammatory drugs. So I was looking for things that could possibly help people with a lot of pain. So I did some research. I came across some Jamaican dogwood, and I thought, yeah, this looks very promising. And I had a text one time from a friend of mine. I was actually in Barron Springs at the time, and a friend of mine had an accident with a circular saw. He was in his kitchen, and he was doing some work on the floor, and he was holding the saw with one hand, you know, those circular saws, and he was cutting a piece of wood with the other, you know, holding the wood and cutting it with the other. And it actually kicked back on him, and it went right in his groin. And so, yeah, this is where all the men cross their legs. Yeah, so it was quite an unpleasant experience. So it severed his scrotum, and it was 1 millimeter away, the surgeon said, from severing his femoral artery, which is a main artery to the leg. So his wife came back, and there was police tape around the house. There was blood everywhere, and he was taken off to the emergency section. He had to. They couldn't deal with it in burying, so he had to go to Ohio. And so I got this text from his wife, said, "Have you got anything for pain?" He's on the strongest painkillers they have in the hospital, and nothing was touching him. So I thought if it were me, I would want at least a couple of options in case one doesn't work, you know. So I sent him some CBD oil, and I also sent him some of our pain, we call it Pain Aid, and it's got some Jamaican dogwood in there. It's got some turmeric, devil's claw, licorice root, and some cayenne in there as well. So cayenne also helps make herbs more bioavailable, and it gives us speedier accessibility to the body to utilize those phytochemicals. So I didn't hear from him for a couple of days, or 2 or 3 days. So we sent that to him, and he was so thankful. He said the Pain Aid, he used the other one as well, but he said the Pain Aid really helped him a lot. He was able to get off of all the pain medication, and he was able to go back to work in a few days afterwards. So it didn't sew anything up. You know, they have limitations, but for pain, it was amazing. So we've used it for cancer pain. We've used it for surgery pain. We've used it for tooth pain. We've used it for crippling arthritic pain, pain that's sort of people rolling on the floor type pain. And it's been, I wouldn't say it's 100% successful, but I'd say we're around 80 to 90% of the time it's working for people. It's usually a matter of getting the dosage correct. So that's the Jamaican dogwood. This is not a standard dogwood. This is from Jamaica. So it's a particular type, Pisidia piscopula, and that is something that is not very commonly found. And then let's look at the mental side of things. You know, I occasionally teach at Andrews University to the nursing students on herbal remedies. And when I was living right next to the university for a few years, and when you walk on the campus, we found there was 2 ginkgo trees there, and one of which was outside the theology department, and one was outside the psychology department. I think God had a sense of humor. But for those who don't know, ginkgo is very good for mental improvement, memory. It helps speed up blood flow to the prefrontal cortex. It's very good for enhancing memory, so don't forget that. Pun intended. Okay, so ginkgo has what we call ginkgosides in there, which help with the acceleration of blood flow. And so this is very good as a circulatory herb. You can also combine it with rosemary. Rosemary has got rosmarinic acid in there, which is very good for memory. And you can also use passion flower. Works in a different way than the other 2, but it's very relaxing. It's very calm. It's a calmative herb. Anyone seen that beautiful? Isn't that beautiful how God made that passion flower like that? We used to grow passion flower, and just the flower, it was just a work of art. It's just incredible how beautiful it is. And so these are some herbs that can help with the mental side of things. If there's a lot of stress, anxiety, you could try the passion flower. As I mentioned yesterday, a lot of people use the oat straw or the Avena sativa, which is very high in minerals, and it relaxes the nerves by feeding the nerves, and very good for brain function, energy production, helps with libido, helps with keeping you asleep longer. So these are very stress-reducing, calmative, and sharpening the memory. Now, there are a number of ways that herbs can help against cancer, and I want to cover 8 particular ways that herbs can help with cancer. One is by decreasing the inflammation. Now, the inflammation is like the nursery breeding ground for cancer to develop. So cancer thrives on an inflammatory environment because what we call inflammasomes, which are chemicals that contribute to inflammation, when they are bathing a tissue, which is comprised of multiple cells, the inflammation can be very uncomfortable to those cells, and it can cause those cells to mutate. Now, I'm not saying all inflammation leads to cancer, but it dramatically increases your risk of cancer if you have an inflammation occurring in the same area for large periods of time. And so anti-inflammatories will help tremendously with that. Also, herbs can help increase apoptosis. Now, this is what we call programmed cell death. So cells need to die, and they're given these signals by other cells that it's time to die, and the cancer cells say, no, thank you. I want to live forever. I want to be like the Most High. Okay? So they ignore the signals to die. They believe in the immortality of the soul, that they can just keep going on forever and ever. But the cells are designed to destroy, you know, there's a programmed cell death, right, in each cell of the body. And so a cancer cell basically has its own law, the DNA changed, right? So the cancer cell likes to change laws, biological laws, okay? And so they don't go by the standard law of the body. It's interesting, all cells of the body have the same DNA, except the cancer cell likes to tweak it to their advantage. So a liver cell has the same DNA as the brain cell, as the stomach cell. But why are they different if they're reading the same information? Well, think about it like a book, okay? Has different chapters. The cells can only read the chapters that relate to them. They can't read any other chapters. It's just specific for their function. All right, so when a cell, like a liver cell, wants to become a brain cell or a stomach cell, it's really changing its function. And cancer cells are not happy with their own function. They want a different identity and a different function. And so this creates problems. Cancer can be created through this change. And then you have herbs can be used for increasing nutrition, which is supportive to fight against cancer, many of which are what we call phytochemicals. They enhance the immune response. They can help with stimulating better immunity through killer T cell activity. They can help with interleukins. They can help with creating greater numbers of white blood cells. Also can help decrease what we call angiogenesis, which is just a term used to describe how you create blood vessels. Genesis is the creation of something. Angio is to do with blood vessels, so it's the creation of new blood vessels. And so cancer has to have its own blood vessel system to keep growing above like 2 millimeters. You know, as far as size goes. Once it gets to a certain point, it has to get its own blood supply. And so certain herbs can help decrease angiogenesis, like cordyceps, for example, like ginseng, like turmeric. They help with decreasing angiogenesis. Also can protect against metastasis, which is where the cancer starts to It likes to spread itself. It sets up its own schools, okay, where it evangelizes and sends little disciples everywhere in the body. So the body quarantines cancer up to a certain point, and when it breaks free of that quarantine situation, you have metastatic cancer. And this is commonly found in stage 4 cancer, okay? So when someone has stage 3 cancer, I have to pay more attention to that because at any point that can metastasize And sometimes surgery is necessary at that point, just to give you more time, because you're in a very delicate situation here. If you don't get that out quickly, it could metastasize. So that's where I'm a big believer in using herbs when necessary, but there are certain times that may require more drastic action. And then also, they can improve organ function, and they can prevent DNA damage and mutation, which is the very thing that causes cancer in the first place. And we have these free radicals that do a lot of damage in the body. They create oxidative stress. They can knock out bonds in the double helix of the DNA and create a situation where different codes are set up to be duplicated in different protein sequencing. And so the plants can help protect against this DNA damage and mutation. Now, there are herbs for parasite support, okay? So if you are dealing with animals, especially cats and dogs, we used to have cats, and it used to gross me out when my daughter would say, all the parasites, coming out and all this type of thing. And so I like pets outside. I don't like them in the house. Okay. But I think they're cute. I like pets. I mean, we have a little Pomeranian dog. It's the cutest thing ever. But he's out of the house. We keep him in the garage, and he goes outside. But if you got pets around, if you're dealing with fecal matter, like your hands in manure, you eat meat products, or you go overseas, third world countries, you got to be more careful about parasites. So what you can do about this, there are herbs that can help with parasites. Now, there's not one herb that destroys everything, okay? And some herbs will destroy the adults, but will not destroy the larvae or the eggs. So you use a combination of herbs. So what we do is we combine the black walnut with the clove, with the wormwood, and then we also add some papaya seeds. Papaya seeds are extremely good for parasites. And so through that combination, you can destroy the adults, larvae, and the eggs. So that's how we do it. You need to use this for at least 25 days. 25 days, okay? And that gets rid of the whole cycle of the parasites. All right, and it's amazing how many parasites people have nowadays. Some of these parasites, like tapeworms, they can grow several meters long, and they attach to the intestinal lining with hooks, and they eat up your nutrition, and they deprive you of things like B vitamins. And they can live there for 7 years at a time. Yeah. I had a lady once, she wanted to send me a picture. I said, no, thank you. But she said, I have one like a snake come out of me. It's like, that's a mercy. I hope no one steals my phone sometime. I got all these gross images people send me from time to time. But anyway, but please don't send me any of those images. I want to talk briefly about contraindications, because we need to be on the safe side of this equation. And so without giving you every contraindication, I'm going to give you a principle, okay? And hopefully if you learn this principle, you'll know what to do, okay? So the principle is this: if you're taking a medication that is stabilizing you in a critical situation, then do not take a herb that has a similar action at the same time. Okay? Does that make sense? All right, let me give you an example. So let's say you're on a high blood pressure medication. Let's say you're on lisinopril. Okay? So lisinopril, it has calcium channel blockers in there. It has all these peptides in there that help to vasodilate, lower the blood pressure. So if you let's say you went to some guy's herb talk and you heard about hawthornberry lowering blood pressure, or nettle helping blood pressure, and you think, well, I can use this as well. So now you've got two agents lowering your blood pressure. You can exacerbate things. So your blood pressure can go too low too quickly, and you can end up with a stroke. Okay? So here's what I do. If people are in a critical situation, let's say their blood pressure is over 200, I'll work with them with their lifestyle to get them in a safe place. Once they're in a safe place, then I can suggest other things, okay? Now, sometimes I work with people who are in delicate situations, and I may be working with people that have some serious medications, but I try to use things that are appropriate, that don't interact, that I can recommend. Now, no one in America can prescribe a herb. Did you know that? There's no one licensed to prescribe a herb. There's no doctor, there's no pharmacist, there's no chemist, there's no Chinese medicine practitioner, herbalist, whatever you like. CD official, yeah, there's no one licensed. So how do we get around this is we say, if it were me, I would take this. So if you ask me, that's why I'm going to give you the answer, okay? If it were me, I would do this, all right? So, because a lot of people, they just take a bit of information and then they go too far with it. So I want to keep people in a safe place. So if in doubt, go without. Work on the lifestyle. Get yourself in a place where you can use a herb in a safe environment, okay? So it's not going to conflict with your medication. All right, does that make sense? Yep, we're all clear on that? Okay, so let me tell you about a herb that has just blown me away as far as results go for the lungs. Anyone interested in learning some herbs for lungs, improving lung function? So this is called lungwort. Pulmonary officinalis is the botanical name. And that's how you spell officinalis. I was trying to get that before. And that's the official officinalis spelling. Okay? All right, so yeah, so this is excellent for helping repair lung tissue. And I didn't realize this when I started using it, how effective it was going to be. So we had people that were going to be on respirators, and people that were on death's door, people who had COVID and long COVID and asthma and emphysema and all these types of things. So a lot of COPD conditions. And so after studying about lungwort and seeing how it worked, I thought, this is very, very interesting, because there's no herb like this that I know that works in such an amazing way. First of all, it's a bronchial dilator. Now, there are other herbs that do bronchial dilation, such as mullein, for example, which is often used for asthma and COPD type situation. But the uniqueness I found about lungwort, I haven't found any other herb that activates the ciliae like lungwort, and it can even clear debris out of the lungs. And there have been people even coughed up what they have told me was part of lung tissue that was necrotic, that the body was just rotting there in the respiratory cavity, and yeah, so it doesn't mean that your lungs are going to pop out your mouth. Okay, just want to make that clear. Okay, but it's very good at getting debris out of the lungs. There's this little ciliae conveyor belt. When smokers give up tobacco, they often get what they call smoker's cough, and because the ciliae starts activating. Before they were paralyzed when they're just on the tobacco. Now it's starting to work, and it just moves this stuff up for you to get it out, clear your lungs. So lungwort does an amazing job of activating the ciliae, and it is very good for low oxygen levels in particular, right? So a lot of people in COVID, they had very low oxygen levels. And in fact, my wife had this when COVID was just getting to the point of paranoia, and it was the last day you could get a hotel. I remember that, because we were traveling up through New York, upstate New York, on our way to Maine, and my wife started feeling she couldn't breathe. And so we didn't know what was going on. We weren't around anyone else. The kids never had it, and they were with us. We weren't around anyone else. We realized it took us 2 years to figure out what the cause of that was. What, is this going live? Okay, I'll tell you after it's off. Okay, all right. So I may get a red flag somewhere. But anyway, it took us 2 years. We figured it out. But lungwort was used, and next day she was perfectly fine. Everything was back to normal. I was at a meeting one time. I was teaching emergency medicine, and I've had this happen a few times on me. When I teach emergency medicine, someone has an emergency right that time. So it's almost like scared to talk about it anymore. In fact, the last time it happened, it was my daughter. She was only 11 years old at the time. I was lecturing at Wellard, and I was talking about emergency medicine, and there was even a doctor in our midst, and my daughter came in. I thought, why isn't she with her mother? Because, she was, my wife was doing an medical exam at the time, so she couldn't be in the same clinical room with her. So she walked down to see me, and she looked like something was wrong, I could tell. And then I went over to her, and she just collapsed in my arms. And I was like, I didn't know what was going on, if she had an anaphylactic shock, if she got stung by a bee, or I didn't know what was going on, but I knew she was in distress. So I gave her some lungwort. She couldn't hardly breathe. And within a few minutes, she normalized, and she was fine. So this is a very good emergency medicine. I call it a medicine. I use an extract. Yeah. So let me just share with you about dosages. They're on the bottle, but usually it works this way. With mild or prophylactic, use 1 serving. Moderate 2, and severe 3. That's usually, now there are variables in that, so dosage varies depending on the person's weight. Okay, so I've had 300-pound 10-year-olds I've seen. So, you give a more high dose in situations like that. I don't do dosage on age. I do it on weight. And then sometimes people are very sensitive. If they're sensitive to medication, then they're usually more sensitive to herbs. So I keep that in mind. And then I tend to start people on a lower dose and then work up over time. In some situations, I do it the opposite, depending on the condition. But sometimes it takes a little time. It may not be immediate, but over time it can build up in the system, and then it works more effectively. Herbs for energy. Ginseng is an amazing herb for energy. And I remember I was given a buddy pass. You ever had a buddy pass? I had a friend, he was in the airlines, and he has these buddy passes. He gave me one. I was flying to the Philippines, and we used one for this Filipino trip. And you get knocked off of planes, you know how it works, and you're the last in line. And so it took me 4 days to travel halfway around the world. And I was exhausted. I came back home, and the Holy Spirit just told me, take my own medicine, take some ginseng. So I took some ginseng, and literally within 20 minutes, I felt like a new man. My energy was back. I just felt like really good again. Now, it doesn't work so well if you're full of energy. You may not feel any effects, but when you're really low in energy, anyone here can use some more energy? We don't give this to our kids, by the way. We give them sedatives. Or calmatives, should I say. I don't want people to think we're giving them drug sedatives, but we try to calm them down, and we use the things that give us energy. But yeah, this is very good for enhancing stamina, fighting fatigue. Just don't use it before you go to sleep. It'll keep you awake. Unless you want to stay awake, then by all means. Nettle, this is probably one of my favorite herbs because it's so good for so many things. Nettle is in a category called tropho-restorative. Does anyone know what that is? Phil, you heard about that before? Tropho-restorative means it helps every body system. And so it's good for every part of the body, basically. It's the most nutritional dense herb on the planet, even more than moringa and sea mosses and some other ones, wheatgrass and all the top superfoods. It's like the number one, okay? So it's very high in vitamins, in minerals. It's high. It's got vitamin A, B, C, D, E, K, and P. It's very high in iron, so it's very good for ladies. If you got anemia, it's high. Actually, this is a herb that actually is high in protein. Now, as mentioned before, a lot of herbs don't have much protein. That's true, but a lot of the green leafy herbs can be high in protein. This is one of them. I think it's over 40% dry weight is protein. So this is actually a very nutrient-dense herb. And it's number one herb for allergies. If you got seasonal allergies, just try some nettle. And usually within a couple of hours, your allergies go away because it's very high in natural antihistamines. And so there's also another herb that helps with that, which is milk thistle. And milk thistle helps stabilize the cell membranes of histamines. So histamines, they basically rupture and they cause this immune reaction. And so milk thistle can stabilize that from rupturing. So nettle does sting you, right? If you put your hand in nettle, it'll sting. It's got some formic acid. It's got a serotonin on the end, and there's one other thing. Was it acetylcholine? I can't remember now, but it will give you a sting. But if you cook it, it will actually take away the allergy it caused you. It's amazing. Nettle is very nutritionally dense. It's very good for the kidneys. It's good for the liver. It's good for the bladder. It's good for the skin as well. And we've had people who've used it for their hair growth. And we've had people completely bald, I kid you not, completely bald for years and taken nettle and their hair's grown back fully. Yeah, it's been amazing. In fact, yeah. Oh. Yes, we do. Yes. So I got into this years ago. Actually, you can go on our website and you can scroll through all the testimonies. We don't ask people to put testimonies up there. I didn't even know our website had that option. And I think everyone except one was a 5-star review. And it's called, we put it in for hair support. So we have nettle by itself, but we also use it with some other herbs for hair growth. And I got into this years ago. I was helping some ladies with their thyroid gland, and they were telling me their hair was growing back. Now, it wasn't that their hair was completely gone or anything. It was just thinning hair. So I thought, let me look into this. So I looked into the herbs. It was ashwagandha, rhodiola, and some nettle. And they were some of the best herbs for hair growth. And so I thought, man, this is interesting. Someone asked me before, can I make some for hair? And I thought, no, I'm not into that. I don't know. I don't want to be seen as a gimmicky herbalist or something. But when I saw it was actually working, I thought, well, maybe I should do something about it. And then I was lecturing down Atlanta area in Georgia, and I was talking about some of these herbs and nettle, helping with hair. And this gentleman came up to me with a big smile on his face, and he said, well, it worked for me. He was completely bald. And I said, well, I don't know. I mean, I've never used it on anyone bald. But that week, I got a call from a truck driver who was taking the herbs, and he kept buying it for a few months. He was buying it. And I said, how's it going? Because I always like to know how things are working. And he said, oh, great, my hair's growing back. I said, so what was your hair like before? And he said, oh, I was completely bald. And I said, can you send me a before and after picture? He just sent me an after picture. He looked like Einstein. His hair was spiking everywhere. I said, you better stop taking that stuff, you know. But he had this little bald patch right on the top of his head he wanted to get rid of, so he kept taking it for a while. But he was one of my best customers, told all his friends. They wanted, but so then I started using it as a hair formula and was getting similar results. So I thought, well, you know, I can't promise, we're not at the tree of life yet, but it's working for a lot of people. That's all I'll say. So let me tell you why you'll never find a product that completely helps everyone's hair. And the reason for that is because there's so many different causes to hair loss. So what the formula that we use is working on is if you have high stress hormones that are creating, like cortisol, will weaken the hair follicle and cause you to lose your hair. We used to joke about that, right? The stress causing your hair to fall out. Now we know how it works. And then the sex hormones. When the lady's sex hormones change in particular, the hair starts to fall out as well, or thin. And then the other one is nutritional deficiencies. So that can contribute as well. So those are the areas we targeted with our formula. But sometimes ladies, they damage their hair by stretching it too tight, and that permanently damages the hair beds. There are certain chemicals that can destroy the hair. I remember one time when I started first seeing my first gray hair, that was a long time ago, and I was tempted to go and get some hair dye from the store. So I went in there one time, and I looked at the packet, and it said, you got to put these gloves on, and then it said, you got to put the gloves in another set of gloves, and then put the hair. I'm thinking, I got to wear 2 sets of gloves to put this stuff on. So I decided it's better to look distinguished than extinguished. So I ended up avoiding using that. And thankfully, my wife likes the gray hair, so you know, I consider that an extra benefit. But with hair loss, you know, these things are some of the main causes: hormonal imbalance, nutrition deficiency, poor blood circulation. If you can help these areas, you can contribute to helping the hair recover. And then we have red clover, I mentioned before, supports women's health, improves skin conditions, aids detoxification. Now, there is no herb that detoxifies everything from the body. I just want to make that clear. The liver is the main organ for detoxification, and we don't use a herb to replace the liver's function of detoxification, but we can aid it at certain times in certain ways. Someone asked me about men's health, sol palmetto. This is really helpful for supporting prostate. We combine this with pau d'arco and red clover. Red clover is particularly good for men's prostates. It can lower the PSA when it's very stubborn. And so far, out of the years we've been sending people off to get PSA tests, I've only seen one person who hasn't gone lower as far as their PSA levels go. So it's very good to decrease the swelling. The urethra goes through the prostate. So when the prostate enlarges, then you can end up with urinary incontinence issues, erectile dysfunction. So what sol palmetto does, it shrinks the tissue. It helps to combat inflammation and hypertrophy of the cells in the prostate, and improves urinary flow, and it really does seem to be working. So we're going to keep using that. So red clover, Pardiaco and Sol Palmetto are the three ones I recommend for that. For the heart, these are some of the best I know. Turmeric, garlic, I mentioned that before, and hawthorn. So that's the new addition to the family here. Hawthorn berry has 3 calcium channel blockers, 3 ACE inhibitors. It helps with nitric oxide production, which is a vasodilator. It can help with lowering cholesterol, can help with improving the left myocardial contraction, which increases the ejection fraction, increases better circulation throughout the blood vessels, even the capillary beds. It's a tonic for the heart muscle, so it's a bit like nitroglycerin that the physicians sometimes recommend, and it does work. So I highly recommend. This is my #1 go-to herb for blood pressure issues, and also for weak hearts, okay, heart failure. I highly recommend hawthorn berry. You know, 80% of women suffer from hormonal imbalances in some way. 70% are unaware they have conditions like PCOS, which is polycystic ovarian syndrome. Hormonal irregularities are linked to fertility issues. Do you know, there was a report done, there was some research done on this from 1978 to 2018. Men's sperm count has decreased on average 62.3%. Okay, that's in less than, that's actually in 50, is it 50 or 40 years? About 40 years, decreased 62.3%. And sperm motility has decreased over 50% in that time as well. So we are getting to a point in this history where there'll be more people dying than more people being born. And so if things continue at the current rate, and this is affecting even animals. There are fish out there that can't give birth. It doesn't matter, dolphins in Antarctica, wherever they are, sperm whales and all kinds of fish are having this problem because of endocrine disruptors. Things like plastics that are being put in the ocean. And we have currently 1,000 endocrine disruptors that we're exposed to in the United States, many of which they impersonate the hormones in the body, mimic the hormones, even things like bottled water. I mean, this isn't too bad, but when you heat this, the plastic is very similar to estrogen in the body. And, you know, I'm not saying we can avoid all these things. We can just diminish our exposure to them. They're in even crazy things you never think of, like candles and thermal receipts, and they're in canned food. And there's just perfumes and deodorants and all kinds of things that are causing these endocrine imbalances. A lot of skincare products as well, especially ladies. If you look at the skincare products that are chemical-based, they usually affect the neuro and endocrine system. And so they're quite toxic, many of them. So be aware of that. We'll just have a break in just a minute here. This is fatty liver. Now, I mentioned this briefly yesterday. There's over 100 million undiagnosed people in the United States that have fatty liver disease. And it's primarily caused through either insulin resistance, which is linked to high amounts of carbohydrates that aren't metabolized properly, and so they end up as fat, and this can cause fatty liver. Now, fatty liver causes inflammation of the liver, causes cirrhosis of the liver, okay? So it's an ongoing problem that links to more complications long term. So one of the ways we can help with this is to change our diet, make sure we're not overeating on carbohydrates. And there's a difference between good carbohydrates and bad carbohydrates. Try to stay with more whole foods. I think generally speaking, we eat probably too many carbohydrates as far as the ratio is concerned. Try to get more proteins and good quality fats. Diabetes. Okay, we'll stop there because this one's going to take a little time. So let's have a 10-minute break, and we'll be back. Get your water. And did you have an announcement? Okay, thank you, Debbie.
So this is our last break. We're going to go into our next session right after this break. And I want to let you know that we do have, like I said yesterday, we do have a supper next door for everybody who would like to have something. We have a potato corn chowder, some rolls. We have salad. Carbohydrates. We have salad. We have salad with some different dressings that you can choose from, and then we have a blueberry crisp. For the rolls, I'm sorry that I forgot to get gluten-free bread, but the crisp is all gluten-free. If anyone has any other food allergies or food sensitivities that you have questions about what's in the food, just let me know, and I can talk to you about that. It'll be easier for most of you to eat at tables. There's just a few little spaces here, but please get your food and come back so we can continue with our session. You can certainly eat while the presentation is still going on. And then don't forget, at the end of the next session, there'll be product in the back for sale. And we are just so thankful that you're able to come and share this really timely information with us. So let's pray before we go next door to get something to eat. Dear Heavenly Father, we thank you again so much for the gift of your remedies that you have provided for us, for these wonderful plants that you've provided for us when we're sick, but also plants that you've given to us so we can take care of ourselves ahead of time so we don't get sick. And so we just ask that you would please help us to do the best we can to prevent getting sick, but then once we do, help us to be wise in choosing those things and those activities that will help us to regain our health back. We thank you so much for Dr. Lee and the expertise that you have given to him, and we just thank you for this opportunity that we have to share and to learn. Please go with us now as we eat our meal. Bless the food that we're about to eat, and please help it to strengthen us and nourish us for the rest of the day. We pray in Jesus' name, amen.
You ready to go? Okay. All right, we're going to start again. I'll be presenting for maybe another 20 minutes, and then we'll have 20 minutes for question and answers, okay? Is that all right? So you just go ahead and eat to your heart's content. Smells good out from where I am, but looking forward to having some later. So we're going to pick up with diabetes, and diabetes is more prevalent than most people think. There's many more people that are pre-diabetic than that are diabetic. And right now, if you include pre-diabetics, you've got about half of the population, the U.S. population, that is either pre-diabetic or diabetic. So that's a very serious situation. So if you haven't got diabetes, a lot of people are heading that way. And, you know, by the time you're diagnosed with diabetes, and I learned this from an endocrine specialist, she said that you have already destroyed 80% of your pancreas. 80%. So the good news is we don't need to get there. And if we get there, we don't need to stay there. All right? So when I used to work at a lifestyle center hospital in Georgia, it's called Wellard, I'd say a third of the clients that came, the patients that came there, they were diabetics. And most commonly, it was rare not to see this, but most commonly, the people went out with no medication after 2 to 3 weeks of being there. So it is something that is not hard and fast. Once you got it, you have to stay that way for the rest of your life. Lifestyle alone is sufficient. Okay, you don't necessarily need to take any herbal remedies for this because, I mean, they can help, but the majority of the battle is won and lost at the dinner table. All right, and so if you're willing to make a few lifestyle changes of what you eat, and you are determined to get on a good exercise program, then it would, you know, 9 times out of 10 in the next few months, you should see some very powerful steps forward. If done correctly, you can do it a lot sooner than that. So I've seen people who've had up to 300 units of insulin. Yeah, can you believe that? Who can't even take a step up to get into the lifestyle center. And in 3 weeks, walk a mile and off all their medication. But it has to be monitored. I'm not saying this is what you need to work with someone who can safely take you through this. All right, so let's look at a few herbs that can help with this, okay? You probably saw this. The first thing that popped out was the cinnamon. Now, there are 2 different kinds of cinnamon. There's cassia and there's Ceylon. Ceylon is the better of the 2, in my opinion. The cassia tends to be more irritating to the gastric mucosa, but they both do work in helping lower blood sugar. Improves insulin sensitivity, and you can see this even in small amounts. I mean, you don't have to take bucket loads of cinnamon. Usually people take about a teaspoon a day. Now, there are other herbs you can use, one of which is showing up here, bitter melon. Bitter melon. Anyone have bitter melon? Even though it's in the Philippines, that was a common. They have in India? Yes. Okay. I don't like the bitter melon. But, okay. Something sour. Okay. Right. Okay. Right. Okay. Right, yeah, I didn't find it very tasty, but it's better than high blood sugar. Yes, maybe I need to go to India. So another great herb we can use is called gymnema. Gymnema, 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 or Gymnema sylvestri is the full name, and this helps with insulin resistance. It's not actually here, I'm afraid, Gymnema, but it's a leaf, and you can buy that from the store. It helps improve insulin resistance. Another one you can use is fenugreek seed. This slows down the transit time of sugar into the bloodstream. It has a chemical called 4-hydroxyleucine, which basically stimulates the beta cells of the pancreas, and so it's regenerative in the sense of helping improve the beta cells in number. Did I say that right? 4-hydroxyisoleucine. That was the. Yeah, I'm not sure if I said it right in the beginning. And then using fibrous foods. So, you know, you got to be careful. It's better to have the orange than the orange juice. I don't recommend for diabetics to fast. Now, there may be times, but generally speaking, I don't recommend juicing. Unless you're taking, digestion starts in the mouth, right? There's no teeth in the stomach, so there's no substitute for mechanical digestion. All right, and so you know, get the fiber. The fiber is not just a broom, okay? It helps with toxins, binds with toxins. It binds with cholesterol. It helps with It also helps with slowing down transit time of sugar into the bloodstream, which is very important for a diabetic. All right, and there's another herb I'll mention. I came across this anecdotally from another herbalist. It's called, what's his name now? John, what's that where's Phil? You there, Phil? What's that Mormon guy that used to John someone? What's that? Joseph Smith? No. He used to be a very practical herbalist. Anyway, he'll come to me in a minute. But he recommended cedar berries to help with type 1 diabetes. Now, I want to be clear here. I'm not telling everyone, if you got type 1, don't come off insulin. And, you know, I just want to be real careful how I state this, because I had this nurse practitioner came in to see me one time, and she had a 9-year-old daughter, and she had been a diabetic type 1 for about 3 or 4 years. And she didn't give her insulin. She was trying to regulate it through diet. So her average sugar level is around 300. So when I mentioned using insulin, she started to tear up on me, and I thought, oh, I hit a nervous spot there, sensitive nerve there. So I said, look, I don't know if this will work, but I heard this from another herbalist that this has a possibility, could help, it may not help, I don't know. But I talked to her about cedar berries. Anyone heard of cedar berries? Cedar berries. The botanical name is what's it called now? Juniperus monosperma. Juniperus monosperma. That will help with your digestion. Juniperus monosperma. Okay, so that is the particular berry that she used. So we worked out roughly what would be a good amount, okay? And she started taking that. She came back a week later. I told her, how many berries for 3 times a day. And then she started, they're very hard berries, so you got to sort of let them soften in your mouth. They have a seed in the middle. And so she came back, big smile on her face. She came back a week later, and she was a nurse practitioner. She had written down 3 times a day what her numbers were. And she was before averaging about 300, but when she did this, it was averaging around 140. So I was 140. So that was, with her, she was on two berries 3 times a day. So I said, keep doing what you're doing. And so she came back 2 weeks later, and she was down to about 110. And then, yes, that's right. So then she came back, I think, another week or 2 after that, and it was down to as low as 80. Yeah, so she was super excited. I was flabbergasted. I mean, I didn't expect that sort of result. And sometimes you wonder, like, how much is the herb doing and how much is God doing? You know what I'm saying? It's like, I mean, we give him the glory for whatever happens, but it's like, is this more of a miracle thing, or is this actually more physiological, helping, from, it's still the Lord, he gets all the glory. And so I was just amazed. She sent me, her parents came out to visit me all the way from Florida. She sent all her workers to me. I mean, she advertised me to everyone. I was really surprised. I was very, very surprised. So we used that also for type 2 as well. It's worked just as effectively. So it's really helped the blood sugar. Oh, sorry, it's gone off here. Thank you. I was talking too long, wasn't I? Okay. So, yes.
Have you seen case scenarios where people have taken insulin for way too long, the pancreas is totally or almost there, and then they stop and they use the herbal remedies, and then the pancreas will revive, and they didn't need insulin any further?
Well, it's a very delicate balance you got to play there, because you don't want to take them off insulin. At the same time, you don't want to encourage long-term if you can avoid it. So you're trying to, it's a juggling act, and you need someone that can work with that person. Well, these are some of the ones I've been mentioning. So, but lifestyle is key. I don't want to underplay that, because, if people could take all the herbs under the sun, but if they're not willing to change their lifestyle, they may only see short-term results, Did I do something here? Okay. Okay, so let me talk about herbs for, hang on, I think it was back here, wasn't it?
Yeah, I plugged that in.
Oh, you did? Okay.
No signal.
No signal. Okay. Huh, shall I unplug it again and put it back, do you think? Okay, so while he's figuring that out, let's talk about herbs for heavy metals. And we see a lot of people having issues with heavy metals because of the lead and the mercury, aluminum, and there's things like copper and cadmium. So let me tell you what herbs are good for chelating heavy metals. 2 herbs I recommend. One is cilantro, and one is chlorella. Chlorella. You want to get the cracked chlorella. Okay. All right, sorry. Cracked chlorella. Yeah. Let me pull this out again. Maybe we'll waken it up. We'll reboot it. Maybe that'll help it. Next one we're going to look at is mullein. Mullein. Oh, there we go. We got it. Okay, thank you. I don't know what to do. Mullein is very good for the respiratory. It's very good for asthma. Asthma. Just remember mullein. You don't want to take the seeds, they're toxic. You want to take the leaf, okay? And very good for sore throats, throat irritation, okay? They're very high in antioxidants, and it's vasodilator, so it helps with breathing. Another one is lavender. Lavandula officinalis, that's the one you want to get. Very good for easing stress, anxiety. If you're very stressed, just walk in a lavender field and you'll be almost instantly transported. All the stress will disappear. Very good for sleep. Also very good for burns. If you get a bad burn and you've got some lavender, just put it on. It's very soothing. It's very calmative. Just handling lavender, it's just beautiful. It just takes your stress away. If you have someone that's got panic attacks or they're going through a shock experience, lavender is very, very soothing and calming. Helps with certain skin conditions, skin irritations. It can help with stress-induced headaches, anxiety. So herbs can be used for first aid. And we've got a big first aid kit at home. It's probably bigger than the paramedics. It's actually a full paramedic kit, but we fill it with all kinds of extracts and essential oils, and it's got clay in there. It's got hydro packs, and we've got pretty much everything to fix anything in there except open heart surgery. We do that. So it's got a lot of really important things for emergencies, and some of the things that you want to be aware about with emergency. You never wake up thinking, today I'm going to have an emergency, do you? But the more prepared you are, the less scared you'll be. So have things in there for wounds, but have things in there for pain. Have some things in there for nausea and for the immune system, for wound care. Things like comfrey, essential oils. Get some cayenne, get some charcoal, get some clay, get some little creams and salves. You'll be prepared. You'll be amazed. We went to the Philippines one time, and we used everything we had, and then the stuff we had left over we gave away, and then we thought we were leaving, and then my son got a fever, 105 degrees in a bathtub of cold water. He was really bad. He was going blind. He told me, "Daddy, I can't see." It broke my heart. He was only 4 years old at the time, and we had given away our medical supplies. So I just used what we had. I grabbed my T-shirt, soaked it in cold water, tried to keep his head cool, put cold compress around his neck, and tried to evaporate the heat off him using just a cold T-shirt, just extracting the heat. And thankfully, by God's grace, he was able to see soon after that. We saw God's divine hand upon that. But we have very little. We have very little at hand to use. But God blesses with the little you have. But it puts you under more stress when you know you don't have it. So just have it on hand, and then you don't have to worry about it if something comes up. And it may not be you that needs it. It may be your family member. It may be a visitor. At least have some cayenne and some charcoal. You don't have to go crazy and do what we do, but just have something like that, because those two are going to help you the most in real emergency situations. And then herbs for thyroid, I would use the ashwagandha rhodiola. They're some of my favorites. You can get some cayenne oil, you make some cayenne oil, and you can rub it on your thyroid. That will increase thyroid function, because the best way to bring healing to any part of the body is to improve blood flow. That's how the body heals, is through the blood, right? The life is in the blood. All right, so you accelerate blood flow, you accelerate healing. And then there's herbs for nutrition, right? So I mentioned before nettle. Nettle is one of my highest on the list. There's red clover, there's oat straw, there's barley grass and wheatgrass, and although be careful wheatgrass. I had some wheatgrass years and years ago, and I was on the floor, belly. I mean, I was just like, I was so much pain in my stomach. So go easy on that. But herbs are. I just think probably I had too much that my body couldn't handle, but it wasn't gluten related. No. Nothing to do with, no, it's just very, very concentrated. I'd rather use the herbs in a form that we can eat. So if you go to our website, we have a nettle soup recipe. So, you know, nettle soup. Yeah, nettle soup. So, yeah, use the herbs in your garden, right? And a lot of these are culinary and nutritional support, and then medicinal. Hawthorn berry, I think we mentioned that before. Yes, salves. Salves are very good for topical things. Who tried the salve, by the way? You feel a difference? Yeah? Okay. So, yeah, that salve I pass around. Oh, it's right here. If anyone wants to try it, didn't try it, don't eat it, okay? It's don't mix it with your salad dressing, okay? But it's do you feel the blood, the tingling sort of effect there? But it's very good for pain relief. So we mainly make two salves, actually. One is called the pain salve, which is that one, and the other one we use for healing, comfrey salve. Comfrey is amazing. It repairs things like you wouldn't believe. It's a cell proliferator. It's very good for broken bones and tissue that needs repaired. About a year ago, a bit over a year ago, I had a rotator cuff injury. Plus, I had a frozen shoulder on my left side. I have a son that he works out like a Navy SEAL, and we had a competition on push-ups. We had to do so many push-ups every day. And then my daughter does aerobics, and she like swinging around on things, and so I was trying to jump up and do a swing, something silly. And there was one, I arm wrestled my son. That was a mistake. I still beat him though, but it was at an expense. But anyway, it all weakened my shoulder, and so I was very much in pain for a few months. And they said I had a rotator cuff injury, a frozen shoulder, and so I started using these. You know those pulley system you put on the door, and you pull your arm up like this. So I was doing that, and then what else was it? So I used the comfrey and I used the pain salve because I was in a lot of pain. And I went back to get an MRI done, and they said, you haven't got a frozen shoulder. You haven't got a rotator cuff injury. And so I didn't need surgery. It was just, I'm so thankful. Now, there are situations if you tear it enough, it may not be able to, you may need that surgery. But I was so thankful because I was looking at major surgery. I have a close friend where I live. He's just had some major surgery and rotator cuff. He's got to do the other one, and it's a very, very drawn-out, painful process. So look after your rotator cuff. Don't do anything crazy like me, but salves are a good way to help with that. Okay. All right. Thanks for listening. We got some questions now, so fire away. Here we go. Yes, brother. Sugar diabetes. Okay. Okay.
Now, I'm walking, I'm eating better. It's not just eating, it's walking, exercise.
Yes, that's right.
Every day.
Yeah.
Now my sugar's down like, say 200 or down to 190 different. And I want to know, what do I need to do to go see the doctor? I was 36 units and then I take about 4 to 6 extra. What do I need to do when I go back to the doctor? I want to get off this insulin, but I want to do it the right
Sure,
way. I don't want
sure.
to cold turkey, but
Yeah. Well, some of the things you can do, you're already doing, you may just need to just accelerate some things, or, I mean, walking is the best exercise for diabetes. Just little and often, that's the key, right? Little and often. Try to avoid eating late at night, because that's where you put on the weight. Keep well hydrated. Sunshine, very important for diabetes. Avoiding fats in particular, like not all fats, of course, but bad types of fats, right? So fried foods and that type of thing. And then berries. Berries are an excellent way, and beans. Beans are one of the best ways to regulate sugar levels, and they sustain you over a long period of time. And a handful of nuts a day. There was one study that was done that showed that there was a 50% reduction in diabetes of taking a handful of nuts every day. Just that alone. So staying on plant-based diet, lowering the stress, as I mentioned before, that's a big cause. Keeping well hydrated, yeah, taking some of these plants. Like turmeric is very good for diabetes. Gymnema sylvestre, fenugreek seed, they can help with that. Nettle is another good one. Moringa is another good one. There are some leafy vegetables that really help lower blood sugar as well. But you're on the right track. So, thank you.
because I had prostate cancer, 12 years cancer, and had the surgery and everything, but what it was, I found out, I've heard that sugar feeds cancer.
Yes, it does. It does. Yes. Don't eat a lot of cancer. Yeah. Sugar does feed cancer. Yes. Thank you for sharing.
Next one, I have to also know I'm dealing with constipation.
Chronic constipation. Okay. Yes, we have something for that. It's called Bowel Mover, and it's got good amounts of mucilaginous herbs in there that help coat the inside of the bowel, so it facilitates better elimination. There's one herb in there called cascara that's more of a purgative, and it strengthens the evacuation process. But that's what I recommend. And just also, here's another few tips. If you're having constipation, try this trick. You at night before you go to bed, get a glass of warm water with a tablespoon of olive oil, and try that the next morning. You'll be surprised how much that will help. Sometimes you can get these little stools that elevate your feet to help with better evacuation. Also, walking after a meal, because that will activate peristalsis, and that will help keeping well hydrated. And walking, because when you walk, your bowels are suspended by tendons, and they just bounce up and down, and that helps facilitate peristalsis of the bowel. So those are things you can do. Yeah, so for a baby, oh, okay. So yeah, I remember you asked me about that before. So how much does she weigh? About 31 pounds. Okay, so is she still breastfeeding? She's not. Okay, so in that situation, I would do like just a few drops, which would work out to be about 5 or 6 drops. Yeah, but you may need to do that 2 or 3 times a day. Yes?
Dr. Wellard, you had mentioned earlier something that is soothing to the digestive tract.
Yes, yes. Yeah, so there's a number of things. We call them mucilaginous herbs, so things that are slippery, like slippery elm, marshmallow, aloe vera, fenugreek, the things that provide like a jelly-like substance that help protect the mucus cells of the body. So those things are very important. If you've got any inflammation in the GI tract, you may want to try that. We had a son, I mentioned to you before, he had some, well, we thought it was either, we didn't have a diagnosis, but either Crohn's or irritable bowel syndrome. And, sorry, not irritable bowel, ulcerative colitis. And so we made a few changes, but we noticed also that when we included flaxseed and psyllium seed, things really helped tremendously. So he had a lot of blood, he was losing blood in his stool, and we were pretty concerned about that, and so we implemented some of those changes. But those are things, mucilaginous herbs help a lot with those types of situations. Yes?
And what are your thoughts about the L-glutarate yogurt, which they recommend for SIBO, small intestinal infection?
The what, sorry?
There's a specific strain of bacteria, L-glutarate,
Uh-huh.
which because of chronic antibiotic use in the
Mhm.
ways
Mhm.
we have lost it, they say when it comes to gut health, especially SIBO, small intestinal
Yes, yes,
infections,
yes.
is just the yogurt made at home, you can make it, you can order it online Amazon. We made it for one of the churches. It takes 100 degrees, exactly 100 degrees, 36 hours of fermentation, and it works like a miracle. It does a lot
Yeah,
of
yeah.
things, especially the gut, immune system, and everything.
Yeah, well, so what do you, she's talking about a small intestinal bacterial overgrowth, and there are all kinds of intestinal flora. There's actually about 100,000 different kinds, even though there's trillions of them, different kinds that metabolize different things. So what I would say is this, I don't necessarily subscribe to getting every single microorganism, because your body can make them out of what we call prebiotics. So prebiotics are the building blocks to probiotics. Okay, so things like chicory root, for example, is high in inulin. You also find this in dandelion, but the body uses that to make a probiotic. So it's like a building block, just like proteins are made of amino acids. You know, these microorganisms.
Coffee with chicory seeds more, or dandelion teas.
Yes, it can help. If you're missing one or low, you're too low in one, it can help build it up over time. And if you take a probiotic, you really need to be careful, because most of them are just expensive urine. You know, they just come in the bathroom, because you see, when you put that in, your hydrochloric acid will destroy that before it usually gets to the small intestine, unless it's got an enteric capsule or it's time released. If it says it's time released, it should be time released. It should be multi-strain, do at least 50 billion strains, and then you have also, what's another thing? Yeah, don't just take it when you're in the situation where your gastric acid isn't in your stomach, okay? Because that will actually break it down in the stomach, and it doesn't get to where it needs to go. So these are little tricks to pick up to make it more effective. Yes, ma'am.
I'm taking lutein for my eyes.
Okay. Yes. Yes. Yes, you can. Lutein is in some herbs as well. For example, it's in calendula, or Calendula officinalis is the botanical name. The yellow orangey flower, you know, pot marigold. That's the one I'm talking about. That's high in lutein. You can find it in certain foods as well, but you can get them from plants. Now, I didn't mention this before, but blueberry. Sorry, not blueberry, bilberry. Bilberry is very good for the eyes, especially cataract protection, and also glaucoma. And we've even seen some good results with macular degeneration. Now, I'm not usually I wouldn't put my neck on the line and say this helps with every person who's got macular degeneration, but it definitely seems to be preventative in a lot of these degenerative eye conditions. So bilberry is a good herb to take. Yes, ma'am.
We'll probably need your contact information.
Oh, yeah, yes. Do you, yes.
If we have some of these serious chronic
Uh-huh.
illnesses, where should we go if we want to be supervised and detox over a 3-week program?
Well, that's a good question. There are a number of different what we call lifestyle centers in America that are actually connected with the Seventh-day Adventist organization, even though they're not funded by them. And we call these self-supporting institutions, such as Wildwood Lifestyle Center, such as Uchee Pines in Alabama. There's one called WEMA in California. There's one, I don't think it's up and going yet, but isn't Pastor Kelly trying to get something going? I'm not sure. It's not up yet. And then, yeah, Eden Valley is another one. Black Hills, sorry? Oh, yes. Yes, there's one. No, that's in Missouri. Yeah, that's another one. My sister here is talking about one, West Salem. Yes, they have one that is a new one, started a few months ago. In fact, I was thinking of joining them for, a while there, but I know Chad Cruiser, he's a wonderful man, very good in herbs, by the way. He's very, very good knowledge of herbs, so I recommend that one. Some of them do. I don't know. I can't tell you how much, but I think they're a lot more affordable than most places, and they're Seventh-day Adventist organizations. They work with people where they're at. So, I would definitely reach out to them and ask them for information on that. Yes.
I'm already taking some homeopathic remedies.
Mm-hmm.
Most of the bilberry and all the other things you mentioned, they've already given me in drug form.
Mm-hmm.
So if I do this and that, is that going to be interacting? Do I need a specific consultation?
So homeopathic remedies, and I just want to clarify what I'm saying here, that if it's true homeopathic remedies, so what they do is they take something, let's say elderberry, for example, and they put it in small amounts in this fluid, and they shake it up, and what's called succussing, they sort of tap it, and then they take a drop of that and put it in another diluted form, and then they do that again, and they do this, it can be up to 10, 20 times, so there's nothing left of the original ingredient. And so I don't believe in the homeopathic philosophy. They even say in their literature you're left with a spiritual entity. So there's nothing actually physical in there that's really of any intrinsic value. Now, there are certain things that they produce that aren't of that caliber, that have less dilution, but they still get to a point where they hardly have anything left of the original ingredient. So I'm a little reluctant to recommend homeopathic.
Ayurveda comes with a lot of the same herbal medicine and mixes and all that. How's that different from
I don't know. I don't know all the different brands. I'm not sure.
What those bioscan machines what these homeopaths use?
Yeah, these bioscan.
I didn't even know that pain existed.
Yeah, so these bioscanners that they often use are very fallacious in giving accurate readings. I could tell you a few stories about that, but yeah. I'll just share this with you that I do send people to get blood work done and different tests done, but as far as these biorhythmic machines, they're very subjective sometimes, and I don't think they're very accurate. You're basically having to lean on other people's false science. I call it false science because you can't really quantify a lot of these things. You can't make sense of them. And they give different readings. I mean, sometimes they're completely off track, and you wouldn't even know. No one would know. And so I think they're very, very subjective and not really very accurate. They make a lot of claims.
There were symptoms which I myself didn't realize I had that issue. I never mentioned in my literature. And just one scan in less than 10 minutes, he came up like talking for 1 hour about every detail of every pain I was having. And I realized, oh yeah, I have this, I have that. And then he also spoke about aromatherapy. It somehow landed that I was already craving for jasmine, the incense, and the machine showed me that the preferences, frankincense, jasmine in the order, and the colors. And I was craving certain
Yeah. Okay, would you mind if I talk? Would you mind if I discuss that privately? Because I know people are going to be leaving soon, but I just wanted to say thank you for having me. It's been a blessing, and I'll give you my information if any of you want to reach out to me. Just don't all call me at once, but this is why. I have a love-hate relationship with my phone, and so a lot of people get upset with me because I don't answer when they call. But I'll give you my contact information, and it's on the bottles as well, but I'll give it to you as well. Our online website is www.americanherbshop.com, and the word shop is SHOPPE. It's the old English name for shop. There's no Americans work for us, and we've got this strange English name that's spelled differently, and we're not really a shop physical store. So we're like the Federal Reserve Bank. Nothing makes sense, But anyway, you can reach out there. On my email, personal email is lee.hhp@gmail.com. And we do seminars. I speak various places, and if you want me to come back some other time, I'd be more than happy to. Just so I don't have to explain this 100 times, the bottles we have there, I don't know if someone could bring one to me, but these are liquid extracts that are made in vegetable glycerin. There's no alcohol. Yeah, I just wanted to, thank you. And they have a glass pipette in there, and so when you pump these, they usually only go halfway because there's some air in there, so you can never fill them. So when it says like 1 dropper full or 1 ml, it's really only halfway. Okay, just want to explain that. So halfway is 1 serving. So as I mentioned before, prophylactic or mild condition, usually only 1. Moderate, most people take 2, and then for severe, 3. That's 3 halves, okay? And you can take it straight, you could take it with water. It's got a 98% absorption rate, so it goes straight in the system. If you have any questions, you can reach out to us. But I just want to thank Pastor for having us here. He's been a great blessing. I really appreciate it. And Debbie, so this is Debbie, for those who don't know, is Pastor Holland's wife. So she's been liaising with me to make this happen, so I really appreciate all the work you guys have been doing behind the scenes to get me here, and I pray that when I'm gone, there'll be something lasting impression somewhere in your life from this program. But we're here to help. We have a ministry, and it's a family ministry, and we want to be God's servants to help bless His people. And so if there's anything we can do to help, we want to be able to serve you. So thank you so much for coming, and I'll be hanging around for a few minutes. If you have any more questions, I'll be more happy to do that. So did you have a quick?
I just have one.
Yes.
Where did you take your herbal?
Where did I do my herbal training?
Yeah.
Oh, okay. Well, I've done it in different places. So I learned from a practical herbalist. My mother was a herbalist growing up. I did formal training through a college in California. It's a herbal college of natural remedies. And then I also did my degree with the International Institute of Original Medicine. And then I also did my master herbalist training with the College of Natural Remedies. And I also spent 5 years at Wellard Lifestyle Center and Hospital. But I tell people my education began when I left school. So you learn a lot more on the job than you do in books. So thank you for coming. I'll hand it back to Pastor, and I appreciate you all.
Well, we're just so thrilled, and Dr. Wellard was being very gracious with spelling shop, S-H-O-P-P-E. I can say this as an American. That is the proper way to spell it. That is, they say we don't speak English in America, we speak American. And so we're just, we're grateful for Dr. Wellard. And again, he will be here. They've set up a satellite of the herb shop right here in the back of our seminar room. So feel free to peruse those things and ask Dr. Wellard any questions. Let's go ahead and pray together and just ask the Lord to be with us for the rest of the evening. Father in heaven, we are so grateful for, again, all of the natural remedies that you have provided. And Lord, we are reminded of the promise of the book of Revelation that the ultimate herbal remedy is the tree of life and the leaves of the tree of life, which bring about the healing of the nations. And so, Father in heaven, we want to be healthy here on this earth, but I pray that you would also help our spirit to be healthy, that someday soon we might be able to access that tree of life again. Please be with all of us as we go our separate ways. Keep us safe. And Lord, we pray that you continue to bless Dr. Wellard as he ministers. Be with him as he travels. And Lord, we pray as they have purchased this land in Arizona, that this gazing at the stars facility that he will be starting would reach people in ways and help people to see your glory and honor. Please again be with us all, Lord. I pray in Jesus' name, amen.